Thank you, Jamal. And I want to thank the First Five Commission, and particularly George Halverson for inviting me to come and speak. Because you all are the choir, should I say the choir? You all are the preachers. And this is an issue that is really personally important to me, and something that I'm incredibly passionate about. And I am just grateful for the opportunity to be able to share this work with you all. Today, I'll be talking about adverse childhood experiences and toxic stress. And I know a lot of you are pretty familiar with this field and this information. Just a quick show of hands, how many folks are familiar with the data around adverse childhood experiences? Awesome. 5 years ago, I gave this talk. That was not the case. And then how many folks are really familiar with the concept of toxic stress and understanding what that really, excellent. So my overview of that will be really pretty brief and straightforward. I am not going to be shy. I'm going to be totally transparent. I have an agenda. At the end of this conversation, really the things that I want you to come away with is, number one, a deep understanding that ACEs affect people of all backgrounds. This is all of our issue. Number two, this is a health crisis, and I mean this in every sense of the word. And number three, that we all have a role to play and that we're all part of the solution. So this work started for me as a pediatrician in Bayview, Hunters Point. I was working for California Pacific Medical Center, and we opened a clinic in one of the most underserved neighborhoods of San Francisco with one of the highest rates of health disparities, Bayview, Hunters Point. And a funny thing happened. As we were getting ready to open the clinic, I literally went around to after-school programs and schools and churches and said, we're opening this clinic, send us your children. And the funny thing that happens when you sit through 3 sermons on a Sunday and get up at the end of every one and say, send us your children, or when you go door to door in public housing projects and knock on the door and say, send us your children, the weird thing is people send you their kids, right? Which was awesome. And what they did was they sent me their kids, and they said, please, Dr. Burke, can you take care of Jimmy? He can't sit still in class. He's fallen out. He's hitting the kid next to him. Please, Dr. Burke, he's got ADHD. Can you put him on some Ritalin? And the funny thing that happened when I did my job, and I actually did a thorough history and physical, what I found was that for most of the kids I saw, I couldn't make a diagnosis of ADHD. I was hearing histories of so much trauma. Kids who were witnessing violence in the community. Kids who had brothers and cousins and uncles who were either incarcerated or, worse yet, murdered. Kids who were dealing with parents who were suffering from substance dependence or mental illness. And then, in my mind, it was, I could see that there was something that I was missing, but I didn't quite know what it was. And then one day, my colleague, Dr. Whitney Clark, walked into my office and he said, have you seen this? And he was holding in his hand the Adverse Childhood Experiences study. And my reaction was probably similar to the reaction of many of you, which was literally, I could feel the clouds part and I could hear the angels singing. Because it just made sense. Everything that I had been seeing, all of my training, everything from medical school to public health school to residency, to the kids that were sitting in front of me day after day after day, it all clicked. And in that moment, it was like, you know, as a physician, I will say it was like the discovery that bacteria causes infection, right? You're like, a game changer. The impact of early adversity and what that does on the health and development of children over the entire life course. It was pretty profound. And so for the 3 people in the audience who did not raise their hand when I asked them if you knew about the Adverse Childhood Experiences study, I'll just briefly go over. This was a study that was done by the CDC, the Centers for Disease Control, and Kaiser Permanente. And what they did was they looked at these 10 categories of adverse childhood experiences, including physical, emotional, and sexual abuse, physical and emotional neglect, and what they called household dysfunction, parental mental illness, substance dependent, incarceration, parental separation or divorce, or domestic violence. And the 2 things that they found that were incredibly striking, number 1, ACEs are super common, right? So 2/3 of their study population had at least 1 adverse childhood experience, and 12.6% of their population, 1 in 8, had 4 or more adverse childhood experiences. Now, this was not Bayview Hunters Point. This was Kaiser San Diego. So remember, we're talking about a population that is 70% Caucasian, 70% college educated. And then the second thing that they found that was extremely striking was that there was this dose-response relationship between early adversity and adverse health outcomes. So the higher your ACE score, the more likely that you were to have poor health outcomes like chronic obstructive pulmonary disease. And when we look at the health outcomes, if you have 4 or more ACEs, your risk of diabetes is 160%. If you got pregnant as a teen in their study, your risk of having a miscarriage was 180%. Your overall risk for cancer, 190%. Ischemic heart disease, #1 killer in the United States of America, 220%. Stroke, 240%. Hepatitis, 240%. Chronic obstructive pulmonary disease, 260%. Depression, 460%. Suicidality, 1,220%. Now, at first we looked at this, right? In fact, Felitti and Anda, the principal investigators of the study, looked at this and they said, okay, now what's the cause of this link? They thought, okay, you folks who are exposed to early adversity, they're more likely to engage in health-damaging behaviors, and we see this in their risk of disease, right? And it's partly true, but there's more to the story. Now, like I said, it's partly true. If you have 4 or more ACEs, it dramatically increases your risk of becoming a smoker as an adult, right? And we see, again, that dose-response relationship. You're much more likely, you're 7.4 times as likely to become an alcoholic as an adult if you have 4 or more ACEs as compared to 0 ACEs. And you're more likely to engage in high-risk behavior such as early sexual intercourse. You're 5 times as likely to engage in early intercourse, and you're twice as likely to have teen pregnancy or teen paternity as someone with 0 ACEs. So they were right. If you have, the more ACEs that you have, the more likely that you are to engage in high-risk behavior. And I'm gonna put a little asterisk there because there's an important driver behind why, which I'll talk about in a second. But even if you don't engage in any high-risk behavior, it turns out that you're still at increased risk of all of these poor health outcomes. And in fact, when we looked at the data for lung cancer, for ischemic heart disease, and for chronic obstructive pulmonary disease, when you do the logistic regression and you back out all of the health-damaging behavior, that only attenuates about 50% of the risk, right? So there's 2 messages there that are really important. Number 1, if you eliminate the health-damaging behavior, that attenuates 50% of the risk. That's awesome, right? So that's one target right there. But the second piece of it is that, wait a minute, like, what do you mean that if I don't engage in any high-risk behavior, I'm still more likely to drop dead of heart disease or cancer? That hardly seems fair, right? Well, the question is why, and that's why I'm going to talk for a second about the biology of adversity. Now, as many of you who are familiar with this work know, it has to do with the fight or flight response, right? Your hypothalamic pituitary adrenal axis. How does it work? You're walking in the forest and you see this guy, roar! Did I scare you? So what happens? Your hypothalamus sends a signal to your pituitary gland, which sends a signal to your adrenal gland sitting here on top of your kidneys that says release adrenaline, release cortisol. And so your heart starts to pound, your airways open up, your pupils dilate, you shunt blood to your skeletal muscles, right? Away from your bladder, which is why you pee your pants. And you are ready to either fight that bear or run from the bear. But another thing happens that's really important, right? I'm going to back up. Now, if we look at my friend again, right? He's big, he's got claws, he's got teeth. And if you were to think about it, right, you probably would not take him on. And that is the reason why our body, in this life-saving mechanism, downregulates the functioning of your prefrontal cortex, right? It inhibits your executive functioning and reasoning so that you decide that fighting him is a really good idea. And that's a critical piece of what happens within the fight or flight stress response. The other thing is the within the brain stress activation center, the locus ceruleus, activates you so that if there's anyone here from Oakland, I apologize. But I will say, picture Raiders fans after a game, right? People are pumped up, right? So this is your within the brain stress activation center. If you're wondering what's doing that, that's the noradrenergic nucleus of the locus ceruleus. And that's the thing that tells your body, I don't know karate, but I do know crazy, right? That's the biological basis for that. And that's awesome if you're in a forest and there's a bear. But the problem is what happens when the bear comes home every night. And this system goes from being a once in a very long time, life-saving activation to being repeated over and over and over and over again. And I want you all to pause for a second and think about some of the kids that you work with. For them, the bear is waiting for them when they get off the bus. Or the bear is waiting for them on the way from home to school. Or the bear is waiting for them when they get home. Right? And this system is activated over and over and over again. And I want to emphasize two things, and this is why I'm so grateful to be able to speak to this audience in particular. Children's brains grow in a way that is experience dependent, and children's brains are uniquely susceptible to the effects of adversity because they are still growing. And so they're making neuronal connections, both, I like to talk about the different types of neuroplasticity. But the thing is, when a child's brain is growing in an environment that is toxic, they have maladaptive brain development. When they're growing in an environment that is healthy, they have healthy and adaptive brain development. And so one of the things that we see is that this repeated stress activation leads to something that we call, the American Academy of Pediatrics has called toxic stress. And I'm going to take a point here because y'all are the preachers. I want to emphasize that toxic stress is not the stressor, okay? So as you all go out and shout this from the rooftops and talk about it with media and your teams and your groups and whoever that you're talking about it with parents and your colleagues, I want to make sure that we all have the accurate information here. The American Academy of Pediatrics has categorized positive stress, which is the stress that I felt 5 minutes ago before I got up on this podium, right? Which is a brief increase in your body's stress activation, a brief increase in that fight or flight response. Then there's tolerable stress, which is a more severe and prolonged activation of your organs and body systems that are responding to stress. And that is buffered, tolerable stress is buffered by the presence of a caregiving system that is able to relieve that stress. Toxic stress is the extreme, chronic, or prolonged activation of the body's physiologic stress response in a way that is harmful to brain architecture and organ system development. So it's literally the physiologic process that is happening. And so that's one of the most important things that I want to share with folks, is that when we're talking about toxic stress, it's the physiologic response, not the stressor, but it is also the long-term changes that happen in the brain and body. And when we're talking about long-term changes, right, we're talking about neurologic changes, changes in the structure and function of the brain, in the fight or flight response, the hypothalamic pituitary adrenal axis, the reward center dysregulation, and this is where I'm going to go back to what I talked about before. The reward center of the brain is one of the areas that many of you folks, if there are folks who have a background in mental health, or folks who have a background in neurology maybe, I don't know, there's something called the VTA, the ventral tegmental area of the nucleus accumbens. And that, I don't just say that to convince you all that I'm really a doctor and I know what I'm talking about. But this is a really important thing, because one of the things that happens when children are exposed to early adversity is it affects the functioning of dopamine in the nucleus, in the VTA, in the ventral tegmental area. This is the area of the brain that is responsible for pleasure and reward, and it is the area that is implicated in all substance dependence. It's the area that is activated by substances of abuse. Cocaine, heroin, meth, even weed activates the VTA, right? The reason this is very important is that when we see that folks who are exposed to 4 or more ACEs have 10 times the risk of becoming an IV drug user, right? Or when we see that they're more likely to engage in early sexual activity, or when we see that they're more likely to smoke. Part of the reason for that is because the dopamine receptors in their VTA are altered. Now, why is that important? Because we sit there and we tell people, don't smoke. Don't smoke weed. Don't smoke crack. Don't shoot up heroin. And it's not getting to the root cause. We have young folks who, from the time they're this big, right, are exposed to high doses of adversity that's affecting the structure and function of their brain. And when we see downstream behaviors, right, that are symptomatic of an altered dopamine function in the nucleus accumbens, then we blame them for doing all the bad things that they do. This is why first 5 is of critical importance, because when we talk about how do we get to the root of the root, a lot of the problems that we are seeing in California nationwide today, they seem so intractable. Understanding the science behind how adversity gets under our skin and how we can use that science to develop programs and interventions that are really going to help people is what, for me, this is like why I am so psyched to be here and why I am so psyched to enlist you all in this movement, because it doesn't take, there's no one of us that's going to do it. Our center, the Center for Youth Wellness, is not what's going to do it. It's going to take every single one of us to figure out how we are going to solve these intractable problems. Now, thank you. The first thing that we did when we, understood the science was I was like, all right, Felidia and Anda, they say that this happened. They had this in the ACE study. But how much does this really affect my patient population? Data, y'all. We need more data because we need to be able to demonstrate this. So we did a chart review. We looked at 702 patients that we had seen at the Baby Child Health Center. And lo and behold, we saw very much the same numbers that Felidia and Anda had seen. 67.2% of our patients had at least one adverse childhood experience, and 12% had 4 or more. One big difference. Felidia and Anda looked at adults and they did a retrospective study. Their mean age was, I believe, around 55. Our mean age was 8 years old. So these kids are not done yet. But for our kids that we looked at, if they had an ACE score of 4 or more, they were twice as likely to be overweight or obese as compared to those with 0 ACEs. And they were 32.6, that is not an error, 32.6 times as likely to have learning and behavior problems in school as our children who had 0 ACEs. And initially when we looked at this, I almost missed something really important when we evaluated this data. So you'll see we have our kids with 0 ACEs on your left, our kids with 1 to 3 ACEs, and then our kids with 4 or more ACEs. For our kids with 0 ACEs, only 3% of them had learning and behavior problems, and for our kids with 4 or more ACEs, 51.2% of them had learning and behavior problems. So this, one thing I try when I talk to educators, I'm just like, yo, if you have not screened for a history of adversity, make sure that you get that done. But the other piece of it is, for our kids who had no ACEs, our black and brown children growing up in Bayview, Hunters Point, only 3% of them had learning and behavior problems. Our children are not broken. Our children do not have a problem that they inherently cannot learn. The impact of early adversity on neurodevelopment is profound, and it is most manifest in a child's ability to sit in a classroom and pay attention and learn. And for me, this is a critical reason why we must get to the root of this public health crisis. So the next thing is that we looked at other data. This data is from Snohomish County in Washington State. And on your far right, you will see they looked at ACEs 3 or more. So instead of doing the 4 or more, which was the cutoff that Felidia and Anda used, they looked at ACEs greater than or equal to 3. And this was actually the only data that I could find around that looked at county data and risk of incarceration. And what they found was that for their population, if the ACE score was 3 or more, their folks were 6 times as likely to be incarcerated as an adult. The Center for Youth Wellness and Public Health Institute last year looked at all of the statewide data for California on adverse childhood experiences. And this data was collected as part of the behavioral risk factor surveillance system. I want to say thank you to Secretary Dooley for committing to continue to collect this data as the part of the behavioral risk factor surveillance system, because without this information, we can't assess how big of an issue ACEs and toxic stress is in the state of California. What we found is in California, 61.7% of Californians have at least one adverse childhood experience, and 16.7% have 4 or more adverse childhood experiences. And when we look at that, that's actually higher than the Falidi and Anda data, right? So the original Kaiser study, it was 12.6% of the population had 4 or more ACEs. This overall California data, 16.7% of Californians had 4 or more adverse childhood experiences. To our surprise, the prevalence level was relatively consistent across ethnicities. I think a lot of us think of this as a particular issue for Black and brown communities. And when it comes to the traditional ACEs criteria, we see that it's actually pretty similar. In the California data, what we saw was that the Hispanic or Latino community had the highest prevalence of 4 or more ACEs. But here's the thing. We know, and this is why it's important to understand the science, why I took a little second to go into it, because we know that the issue is activation of the stress response and the physiologic response, and that's what leads to toxic stress, right? So the traditional ACE data don't include the experience of discrimination, right? They don't include the experience of community violence. They don't include what happens to someone's fight or flight response when they hear about police brutality and then they see a police car driving past them, right? That's another activation of the stress response that doesn't get to be quantified in this work. So we know that it's a special issue for Black and brown communities. At the same time, this is all of our issue, right? There's none of us who feel like, phew, that's them, not us, right? In fact, at the statewide ACEs summit that we held in November, I did like a quick back of the envelope calculation, so this is not from my policy team. Cecilia, don't hold me to this. But when we look at the California population, we break it down along these prevalence lines. There are more Caucasian people in California with 4 or more ACEs than there are Black people in California. Contemplate that for a minute, right? What does that mean? It means it's a public health issue. It means we have to have broad cross-sector solutions, and it can't just be about this community or that community or targeting it only among low-income folks. All right, so I'm gonna shout out, what do folks guess is the county with the highest prevalence of ACEs?
Humboldt.
Humboldt? Anyone else? Mendocino? Y'all read the report. This is really awesome. So the folks who said Butte and Mendocino are absolutely right. Butte County, 76.5% of the population have at least one adverse childhood experience, and 30.3 have 4 or more adverse childhood experiences. And I just want to take a second. I want you guys to go back in your memory and think about that list of when you have 4 or more ACEs, your relative risk for diabetes, heart disease, stroke, cancer, all that stuff. In Mendocino, in Butte County, 30.3% of the population have 4 or more adverse childhood experiences. In Mendocino and Humboldt counties, which we had to aggregate that data, 75.1% of the population has at least one adverse childhood experience, and 30.8% of the population have 4 or more. So hopefully, I have done my job in convincing you that this is a public health crisis. And that's a good thing. And I'll tell you why. Because when we are working in a neighborhood or when we're working with an individual family and we're trying to figure out, God, it just feels like I'm fighting an uphill battle, it's really difficult. But when we recognize that it's a public health crisis, then we can start using public health solutions. In 1983, the time between diagnosis and death from HIV/AIDS was 6 months. 50% of people were dead 6 months after they got that diagnosis. Today, on standard antiretroviral therapy, the life expectancy is greater than 50 years. How did we get there? We had to take a public health approach. Number one, sure, we had to say condoms and needle exchange, condom and needle exchange. This is how you get it, folks. Guess what? Did you know you have unprotected sex? You can get HIV, right? And people started incorporating that. And then we had to invest in research, right? And we had to figure out what is causing this. Man, it's a virus. Oh, wait, no, it's a retrovirus. Oh, snap. Okay, well, we can figure that out. We're going to develop some antiretrovirals, right? Literally, this was the process. And here we are 30 years later, and there's a dramatic difference in life expectancy. And that is the power of a public health approach. And that is why we created the Center for Youth Wellness. Our goal is threefold: to prevent, screen, and heal the impacts of adverse childhood experiences and toxic stress. And let me tell you, step one is public education. CYW is focused on doing early identification and intervention that is based on the science, right? So we recognize that over the past, I would say, 20 years, we have done an amazing job of incorporating science of early childhood brain development into First Five, into our policies, into early preschool, all of that kind of stuff. Now, one of the things that's really important is a recognition that adversity actively downregulates the prefrontal cortex. So what that means is that in a setting of high adversity, even if you provide an enriched environment, it's not going to be adequate. You have to release the brake, right? You have to release the inhibition of the prefrontal cortex in order to allow our kids to absorb the enriched environment so that they can thrive. First Five California has been a leader in doing this work. We know, first of all, First Five has demonstrated that, number one, the two-generation approach is the gold standard. We have to look at children, but we also have to look at their environment. The only way that we're going to be able to do this as a public health approach is if we create an ecological change, right? An ecological change, what does that mean? Well, we have examples of what partners are doing all around the state. In San Diego, San Diego has developed a trauma-informed guide team working to become the first trauma-informed community in California. Yolo County is leading the way with their trauma-informed juvenile justice practices. In Merced County, Dave Lockridge leads the organization ACE Overcomers that is taking a faith-based approach to addressing ACEs. And in San Francisco, Ken Epstein is leading the Department of Public Health to develop trauma-informed system of care, training the entire Department of Public Health on ACEs and the effect of trauma on the health and development of children. ACEs Connection is an online community that was developed by Jane Stevens that all y'all can go home today and sign up for. And one of the things that's amazing about ACEs Connection is that it allows folks to be able to partner with folks who are doing work locally, county-wide, statewide, and nationally. And finally, I want to take a second and share with you Center for Youth Wellness hosted California's first Adverse Childhood Experience Summit in November of last year. I want to share with you a little bit about what was done and all the folks who were there and what this movement means.
Adverse childhood experiences and toxic stress is a public health crisis because we now have the science to show us not only do traumatic experiences in childhood have an effect on one's emotional health and well-being, they also have an effect on one's physical health and well-being.
Do I think ACEs is a public health issue? It is the leading public health issue of our time.
Our mental health colleagues have been sounding the alarm on this for decades.
And Dr. Bob Ross, who is the CEO of the California Endowment, said something very, very, I think, poignant. And he said, childhood trauma is the #1 public health crisis in the United States that is hidden in plain sight.
In order to accomplish this goal, no one place can do it alone. Partnerships are really critical, and it's not difficult to get partners when you're dealing with children who are facing the adversity that we know from the ACEs studies.
The fact is it crosses so many sectors, so it doesn't just affect health and medical health. It affects mental health, education, juvenile justice. It affects all of these different sectors, and when we can really draw those clear, bright lines, we can all work together. I'm very hopeful about change.
We're basically understanding now at a scientific level is what Frederick Douglass told us a long time ago, and that is that it's easier to build strong children than to repair broken men.
I'm Jane Stevens. I'm founder and editor of ACEs Too High and ACEs Connection, and I'm inviting you to join the movement because health begins with hope.
So that's a little bit about some of the work that's happening around the state. I want to close by sharing what you all can do today. So #1 is join the movement. So whether it's signing up for ACEs Connection, connecting to get information from the Center for Youth Wellness, it is going to take a groundswell of grassroots support to be able to impact the national conversation and change the way that we look at this as a health issue. And one of the things that I think is really critically important, and particular for First Five, is that First Five has been a leader in advocating for children's health, education, and well-being. And this is a health issue. One of the things that's so challenging for me is when I see that our response is only in the mental health sector. When we look at some of the best practices that we can do is, for example, integration of primary care and behavioral health, right? Like that is one of the things that we can also champion. Another thing that we can look at is the way that we will be able to advance this and demonstrate the cost-benefit analysis, right, is by understanding the savings that we're going to gain in treatment of heart disease and cancer and all of the other things that are on that list. We currently spend 17, almost 18% of our gross domestic product on healthcare. And it doesn't matter which side of the aisle that you sit on, folks are trying to figure out how to stem that tide. And getting to the root of the root to be able to prevent long-term health problems and, oh, by the way, increase people's quality of life and their well-being, that seems like a very important investment. Partnerships are going to be crucial in moving this work forward. Today we heard about Kamala Harris advancing the Bureau of Children's Justice, and within, check out her tweets. I was following Kamala on Twitter, and she put up our data that says 1 in 6 Californians has 4 or more ACEs. I was just like, awesome, cross-sector collaboration, I love it. Start local. This really has to be grassroots work. The federal government is not gonna come down with a mandate to tell us how to do this. We need to tell both our federal government and our state and our local governments what we plan to do about this. We need to advocate for more research, increase data collection on the prevalence and the relationship between ACEs and adverse outcomes, and support research to determine evidence-based practices for effective interventions. You all can be part of training professionals who work with children who are experiencing adverse childhood experiences and supporting efforts to integrate behavioral health and physical health. Finally, some of the most important work that we can do is just educating ourselves. Every single one of you today got a copy of our report, A Hidden Crisis, that includes all of the California statewide data on adverse childhood experiences in your packets today. Educate yourself, the parents you work with, the families that work with. Shoot, shout it over the fence to your neighbor. Educate pediatricians and healthcare professionals. I'm really sad to say this, but my colleagues in healthcare seem to be the slowest to get on the bandwagon, and they absolutely need to be part of the solution. I know there are folks here from the American Academy of Pediatrics, and yeah, give me a shout out. And this is about that ecologic change, right? How do we change our environments in a way that recognize and address adverse childhood experiences as a root cause for health issues? We are at a tipping point of this public health crisis. By changing the lens and the framework to incorporate adverse childhood experiences and toxic stress, we can change the lives and the futures of our children and our generations to come. Finally, I'm going to end by asking y'all for a favor. So I did a TED Talk on adverse childhood experiences and toxic stress, and it drops next Tuesday. And our goal is to share this message with 1 million people. So I'm going to ask you all to, whatever way possible, I don't know, you follow me on Twitter and tweet it, sign up for our newsletter. If there's a way that we can get it all out to y'all, if you send it to 10 of your friends and tell them to send it to 10 of their friends, imagine the impact if throughout our nation, folks have this information as a basis to think about how we are planning and investing in early childhood. Help us spread the word, join the movement. Thank you so much. It's such a pleasure and honor to be here.
Wow. Oh my goodness. Give her another round of applause.